So, good evening, friends, and welcome to another amazing episode of Crossing Boundaries. As all of you know, we started this during the pandemic, and right now we are almost in the 27th episode. This is just to tell you that this is one way of helping us reach out to our patients and help them understand the various dental modalities we have and how we can go about the treatment and what exactly happens during the treatment, right? So, with those few words, let's get started. Good evening, friends, and once again, welcome to the Crossing Boundaries session, session number 27. And today, our topic of discussion is going to be complete dentures or full dentures, right? So, let's get started. When patients come to us and they don't have a tooth, or they have extracted a tooth, or they have a one single missing tooth, or multiple teeth next to each other, then we can give something called the partial denture. Now, if the patient has all the teeth extracted and has no teeth in the oral cavity, then we give them a full denture. So dentures can basically be classified into partial dentures, which means there are only partially edentulous areas or teeth which is missing, or it could be full dentures where all the teeth are missing. Now, when all the teeth are missing, this is how you would see the oral cavity, the upper and the lower jaw, and there will be no teeth there. And when we give a denture, this is exactly how it is going to be. It is going to replace the lost bone, the lost soft tissue, and the teeth, along with the entire the entire look of the patient, where they will be able to smile, eat, and speak properly. So you have various types of full dentures. One is called the conventional full dentures. Now these are the dentures which you must have seen your grandparents wearing it. And today we have what is called the implant over dentures, or we place an implant and over that we give a denture. Now this gives a lot more stability to the denture. It gives a lot more rigidity, so that the dentures are not flexible, and the dentures don't move in the oral cavity. And also there's a sense of better self-esteem and self-confidence for the patients who wear these kind of implant supported over dentures. Now, what are the parts of a complete denture? The complete denture has, like you saw in the picture, it has a denture base, and then you have the artificial teeth. Now, how do we select the dental base, right? So now we need to understand that each of our skin color are different. Similarly is the difference in the color of our gums, right? So we can have a number of shades where we can choose the color which will be very, matching to our gums, and definitely to our lips, to our tongue, all the pink areas in the oral cavity. Now, similarly, how do we choose the teeth? We choose the teeth depending on the gender of the patient, the age of the patient, and in case they have any other characteristics in the teeth, we are able to choose these teeth according to that. Now, when you look at the women's teeth, you will see them a lot more long and feminine, whereas the gents' teeth, if you look at it, they'll be a lot more broader and shorter. So this is the way you will be able to classify or give a kind of, the kind of a differentiation between how a man's complete denture would be, or a woman's complete denture would be. Now, whenever a patient comes to the doctor's clinic, what the dentist does is they take what is called the primary impression. Now, when they take this impression, they will ask you to either lift your tongue, move your jaw right and left, or pull out your tongue. Now, why do they do all this? It's because there are a lot of anatomical landmarks. And these anatomical landmarks, if you look at it, you have to relieve them. Otherwise, they will hinder or they will dislodge the denture when it is in use. So, it is very important to respect the anatomical landmarks and accordingly give the denture. So you can see here today with a lot of advancement in technology, the impression making is almost stopped. Today we use digital impression technique. So you can just take your scanner and you can go and scan the patient's oral cavity, both the upper and the lower, and then along with the dentures, you are getting a kind of, everything is so sophisticated and so mechanized right now that you can get absolutely well-fitting dentures with no changes or dimensional instability is not there. So let us look at the traditional technique of doing this and a simplified technique. So as I told you, as the patient comes to the dental clinic and expresses their idea or their interest in having a complete denture, first what we do is we take what is called the stock tray, or a tray which is generally available within the practice, and they take an impression of the upper and the lower mouth, and then after this they send it to the lab, and the lab will pour the cast and get a definitive impression for this patient, which will be a custom made tray would be made and sent back to the doctor. Now, using that, they will use a border molding technique of trying to get a good adaptation of the material so that the dentures would fit approximately into the oral cavity with as much less amount of tissue damage or less amount of mobility when the patient is able to open the mouth. And along with that, they also use a material which will be able to record all the very minute details of the patient. Now, after taking this impression, you again do what is called, you register the occlusion, you take the impression and pour the cast. And now with that final cast, you start making what is called the bite trims. Now, with the bite trims, you get the occlusion done. You see the vertical height of the patient, see the smile line, see the, between the pupils, so interpupillary line, and between the pupil and the ale of the ear, you have to draw a line. And then from the nose also, so you can see how they try to map the absolute back of the oral cavity and give a kind of natural dentition that the patient can have. So right from the smile, right from the movement or the cant of the dentures, everything is pre-recorded and kept, and that is being transferred into what is called the articulator. Now in the articulator, what we do is we try to match the teeth and we try to fix the teeth in the bite trims, and then we bring that back into the patient's mouth. So all this is made out of wax. Now, after you bring it to the patient's mouth, you again check the vertical dimension, see the smiles, see whether the patient is comfortable, see whether there's fullness of the oral cavity, because when they lose their teeth, they also lose a little bit of the gums and the bone level. So we need to give them a natural kind of a look that which is possible for the patient. And after this, after the patient is approved, we try to at least check on some phonetics, and then we start processing the denture. Now, once the denture is processed, it comes back, we polish it, we trim it, we make it into a nice shining denture, and then we bring it to the patient's mouth and deliver it to the patient. Now, this is what we do. It's the traditional technique. But now there is a lot more of simplified technique. As I told you, you have a lot of scanners who can take the impression. So there is little or no distortion of the impression itself. And then we do the occlusal registration. And after that, we do clinical evaluation. And then we go ahead with the processing, and then we give the delivery of the denture. Now, today there are many dentures which, come with a kind of, a trademark inside the denture, which we call the BPS, or the biofunctional system of the dentures. Now, this system is so very important because it gives a kind of a high quality dentures, and these are very well-fitting dentures. It helps the patient to bite properly, chew comfortably, and speak speak very clearly because of the placement of the teeth, and this also helps them increase their self-confidence and self-esteem, and hence the patient is much more comfortable with the BPS dentures. Yes, there is a price they pay for it, but nevertheless, you will see that the patients are much more comfortable and confident. Let's take a closer look at the pink part here. You will see some red lines, very small, fine lines. Now, this gives a kind of an illusion for the denture to look as natural as possible, especially looking like the veins and the, the kinds of blood capillaries going all along the gums. Now, care has to be taken to see that, we maintain the good hygiene of these dentures. So usually the aftercare is like, we tell the patients to come back after 24 hours of wearing the denture. For the first 24 hours, we ask them to wear the dentures continuously, and then we call the patients back. And after we call the patients back, we try to check their flange levels. So we see if there is any dental stomatitis or anything which is irritating the gums or the remaining bone, and then we trim the dentures so that we can give them a more comfortable way of wearing the dentures. Now, how do I take care of my dentures? Definitely keep a bowl of water and then only clean the dentures, so that in case it slips off your hand, then you know that the denture will go only in the water. Now, if it is not done that way, then the patient can have a fractured denture like you see in this particular picture. Now, what we do is we send this to the lab, they make grooves appropriately, bring or approximate the denture, and then they make it, they add the material again, and then the denture is brought back into the patient's mouth. However, proper care is very necessary. You can use polishing agents for the dentures so that they smell good and they look very clean. And you can brush it every day, twice daily, before you wear it in your oral cavity, and after you wear it, before you put it into the overnight, water content box. And one more thing is very important, like, you change the water every day. You don't add any hot water or cold water. Normal tap water should do, and because this is made out of acrylic and it can absorb water or it can give away water, so it's very important that we take care of the denture health. And generally, we say once in 3 years to change the dentures because of this quality of, absorbing the water from the oral cavity, and there is some kind of a warpage of the denture. Now, it is very important that patients who don't have teeth definitely go to a dentist and wear these kind of dentures so that they can have a comfortable life and definitely a better lifestyle, right? So thank you so much for joining in today. This is your own Dr. Vidyaa Iyer signing off. If there are any questions, please feel free to contact us. Thank you. Thanks for your patience.